My name is Aaronissa Alleyne. I've been with Unity Healthcare for 10 years in human resources. My current role is Vice President of Human Resources at Unity Healthcare. I'm responsible for the oversight of all things HR that pertains to recruitment, training and development, benefits and compensation, and anything that is to motivate, engage, and retain our workforce. Actually, it's how does the families impact the site selection? That's really the proper approach to making your decision. To really find a site that not just meets your personal mission to provide medical care, but also your family's needs. When we talk about long-term commitments to serving the underserved, it's important to make sure that we support not just the provider, but the family that supports them. In any workforce, work-life balance is important, specifically when you decide to work in an underserved population. As we speak to families, some of the general questions that we would encourage any member to make is to ask specifically things that are relevant to what you do now. You know, where you live, ask questions about school systems if you have school-aged children, ask questions about recreational activities if that's important to your family now. So really take a snapshot of what makes your current environment comfortable and see how would that play out if you were to relocate somewhere else. Understand what are your must-haves, what are going to be items that are going to be important to you in order for you to be successful in whatever site or location that you decide to go in. With joining the National Health Service Corps or Nurse Corps program, there are several resources that they do provide to make the decision to participate in the program and to make the right selection. Review the website and all the resources that it has to offer. The webinars are great. Have your questions available. Research some of the sites on your own. So when you're able to do the virtual job fair, you're able to ask specific questions that would impact your decision. Working for the underserved is not just a job. It's not a title. It's not just a discipline. It is really a call to give greater of yourself. It's the ability to serve a mission outside of the regular calling of just, seeing them from a medical perspective. It really is trying to assist the patient from all aspects.